is just to set the stage, share a little bit what has been happening under the ambit of the CoreNet Nutrition and Food Security Working Group and sort of allied networks of researchers looking at food and nutrition related issues, and just sort of lay the context for why data is really quite important, and how we as researchers maybe could do a few things a little differently, a little better to connect with the implementation ecosystem. I want to acknowledge that our own support to CoreNet and to the work in this area are supported by existing grants from the Gates Foundation as well. So one of the things that we did around this time, or maybe a little bit later last year, was to just come together, as a group of people interested in nutrition and food security, and say, what is it that we might anticipate as the potential impacts of the pandemic and the associated policy measures on nutrition and food and nutrition security and nutrition outcomes. And so we built on sort of existing frameworks and emerging work, emerging insights on what some of the pathways were, and we sort of laid out, a framework of pathways to potential change. And then within this, we acknowledge that the impacts on malnutrition in India of the pandemic could be both direct and indirect, that they would operate through multiple pathways, not just a food pathway potentially, but also through, education and marriage pathways, through changes in availability and access to food, but also that some of the impacts of the pandemic on malnutrition could be mitigated by social safety net programs, et cetera. And so the group that came together around this, which was very much the nutrition development partner community, actually is the group that came together around this framework. We decided at that point, I guess around May, June last year, that what would be really important to start to bring together data on, because you could collect data on lots of different things, but we should prioritize having available data or consolidating insights on food security itself, the reach of food safety nets, and then given the state of where the National Nutrition Mission was and the delivery of health and nutrition programs, that we should also look at what was going on in the nutrition programmatic space. So we sort of honed in on those 4 areas, and I hope to give us a little overview today of what we've learned and what we did on that. So the nutrition, actually, I think I already summarized it, that, we came together and prioritized both the nutrition group and the data stakeholders within the nutrition group. And we sort of validated that with the community of researchers that are in CoreNet. So these are the things we agreed would be quite, important for us to keep our eyes on from a data front. Now, one of the things that, none of us were in a position to actually, or had the resources to just go out and do some, mega surveys to look at these 4 areas. But what we realized was that over the course of, I think especially March to about September, October, that a lot of different people had been doing work on understanding what was going on in the food and safety net space. And it also became quite clear to us that, in fact, people were doing things a little bit differently. Different people were measuring what was going on with people's food or diets or other such things differently. And so we really prioritized the idea that we should review what people were doing, different researchers, and really sort of understand what was going on with the measurement space before proposing anything sort of new and different. And so one of the things that we did was to try and understand how a lot of the phone-based surveys were measuring food security, and we wanted to sort of compare what people were doing to the globally validated tools for measuring food security, such as the Food Insecurity Experiences Scale, the Household Food Insecurity and Access Scale, the Coping Strategies Index, et cetera, and see if we could come together to provide some consensus-based guidance. I'm just going to give you a little snapshot of what that looked like. So we collected and reviewed 15 questionnaires from 11 research organizations, primarily in the CoreNet ecosystem, that had conducted phone surveys between March and October. And then we assessed what they had measured against the domains of food security that are typically measured in validated food security instruments. And so what we found is that most of the surveys had used or adapted the food insecurity experiences scale or the household food insecurity access instrument, the HFIS. Most of the other surveys, which had not sort of fully adapted the tool, had actually measured access to food or resources. A few surveys had actually tried to measure actual consumption or change in quality and quantity of food consumption over the course of the pandemic. Surveys focused very little on food deprivation, coping behaviors, or issues related to uncertainty around food consumption, which are really sort of central domains that should be measured when you're capturing food insecurity. And then, of course, there was lots and lots of variability. You know, some surveys asked, for example, just around the recall period. Some surveys asked about the last 7 days. Others asked about 30 days. Sorry, that shouldn't be 30 months. You know, others framed questions as during lockdown or since lockdown. So lots of things to be done just on the measurement front there. Just to give you a sense of, you know, what this looks like, these are the kinds of domains of food or dimensions of food insecurity that the different global sort of the validated tools look like. But, you know, if you just take a look at the left-hand side, the kinds of things that we expect good measures of food insecurity or food security to capture are issues related to uncertainty or anxiety, issues related to quantity, quality of food consumption, issues related to food deprivation or hunger, the quality of diets as captured by dietary diversity, coping strategies, and access to food and resources such as the access to safety nets. So across the globe, different kinds of tools, you know, measure different kinds of things. And what we tried to do was say, okay, how did the tools that were used in India sort of line up to those dimensions of food insecurity? So what we found, for example, we reviewed, you know, the tools that were used by NCAR, by SEGIS, I don't know how you say that, by IDinsight, of course, you've done multiple rounds, IGC Pop Council, as well as a survey done by Dipa's team, the Hunger Watch survey. And what we find is that the IDinsight and the Hunger Watch surveys actually captured almost the complete set of dimensions, but none of them actually captured, for example, the element of dietary diversity. But these two tools did capture all of these different dimensions that we expect to be measured. And then, you know, we at IFPRI, because we use mostly the FIES or the HFIS, we had also done work to capture most of the food insecurity dimensions, but we had not, in the survey questions that we had administered, had not necessarily looked at issues related to other access to food or to the government sources. So overall, I think we just took away sort of that there was this bit of a patchwork here, but there were some you know, available tools that had captured most of the dimensions. Now, why does, you know, this issue of harmonizing or thinking about what you're measuring make such a big difference? Because, you know, what we realized is that even though at a dimension level, for example, different tools, so we really went nitty-gritty and actually looked at the questionnaires, et cetera, and the questions that were asked. But when you look at it from a dimension perspective, it looked like most of the surveys had asked about lack of access to food. But if you direct yourself to the right-hand side of that slide, what you see is that the questions asked were ever so different across the different, you know, people who had done the measurements, right? So one asked, in the last 30 days, did any member of your household ever go to sleep at night without eating? Another asked, is your household consuming the same amount of food as before the lockdown? The third asked, what has been the main source of food? And the fourth asked, you know, did the lockdown affect your eating habits? Now, all of these at some level map to issues related to access to food, but because they're all asked really quite differently, they will obviously deliver different results. And so it becomes really hard to say, you know, who is really affected by what and in which locations. And what does that then mean for where action needs to go? So on the food security aspect itself, I think one of our key recommendations, which is the gray box in the bottom, is that harmonized measurement at this point in time is actually really quite critical to be able to track what is happening with food security and really support, you know, comparative analyses across both the CoreNet network, but also across geographies in India and link to what you know, implementers are doing. Because if people don't know the extent, severity, depth of food insecurity and linked access to the food safety nets, it's very hard to figure out, what is it you need to change, and does the change actually deliver the outcome? One of the things that I learned about just yesterday was that in the UK, the Food Foundation did 7 rounds of surveys in the last 1 year, representative across the country, using the same tool. And that has been very, very, very powerful for advocacy related to hunger, and especially child hunger in the UK. We need to be getting to that point. So as I lead to sort of closing up, I want to share with you, what the network did on nutrition services in the context of COVID-19. So here again, we drew links between the nutrition development partner and stakeholder network and the work that was happening with CoreNet. And within the nutrition partner network, we realized that a lot of people had the ability to, or access to, platforms to be able to collect data on nutrition services. And so we convened, this network of partners. As you can see, they go, across states, Bihar, Chhattisgarh, MP, Orissa, Tamil Nadu, Telangana, and UP. And the goal of the Nutrition Focused Research Collaborative was to characterize the extent of disruptions, but also in a positive sense, restorations and adaptations to service delivery, and to understand what frontline workers had been doing that enabled adaptation. One of the things we did very purposefully with this network was develop a sort of a common core instrument, so that across the network, we have comparable data, questions that have been asked the same way in all of these different states, and are able to, then sort of say a little something, at least with harmonized measurements. In a sense, also, show this to you as an example of what can you get when you have harmonized measurements. So the kinds of things that we looked at with a questionnaire that was designed together, collaboratively and used as a common core, is we looked at issues related to, on the left-hand side of the slide here, adaptations to service delivery, focusing very much on nutrition services, given the emphasis of Poshan Abhiyan, etc. Communications channels that frontline health workers were using, COVID responsibilities and COVID knowledge. And these were all surveys, phone surveys administered to the health workers, not to the households. We also used available administrative data from the Indian HMIS data, which was available from December 2019 to June 2020, and chose a few indicators that mapped to the questions that we had asked health workers services of. And so in the subsequent slides, you'll see sort of, both of those analyses. I should say at this point that June 2020 is still the last date for which administrative data is available on the HMIS website, and that needs to change immediately, because right now nobody knows what is happening because it's not available in public domain. So what we found, for example, on Village Health and Nutrition Days, and this is just illustrative, the full presentation is available. We're happy to share that. But what we found was that across states, in those orange bars that you see on top and across the different states, you find that there was a dip in the number of health workers reporting doing the HNDs in April last year, but that restored pretty quickly, so that by the July, August, September timeframe, when we were interviewing them, the restorations were very apparent. And if you look at the analysis of the HMIS data, again, you see that the changes between December and April, in a sense, reflect the lower provision. So that's the map on your left. Between April and June, you see an increase. So, in green, that just means that in most of those areas, they were reporting substantial improvements in the provision. But if you look between December and June, which is the third map on your side, you see that many of the areas, even in June 2020, were still well behind what was happening in December 19. In a sense, these are just examples of what you can do when data is available in public domain to understand what is going on with services. And then I'll end with just two more. Sorry, on food supplementation, what we found across the board was that it was very interesting because a lot of food supplementation was redeployed to home delivery. All the Anganwadi workers, practically all who we interviewed, very high levels, were distributing food supplements already in April, but they were a little bit lower in some states. The primary adaptation for food supplementation was actually to direct drop them to beneficiaries' homes. But in MP and Telangana, they were available, I believe, for pickup at the Anganwadi centers as well. So, we also, by interviewing providers, learned a lot about the kinds of adaptations that they were making. So in summary, on the service delivery, we also have some data on challenges, but I'm just going to skip that to go to the next one because I know we'll run short of time. The difference between, I think, what we can say on service provision versus what we can say on food security is that because the food security data is absolutely not harmonized, at this point in time, I think we can say very little about, in any consistent way about what has happened to food security around the country. It is a total patchwork of findings. But what is possible for the service provision with the work that we did across these few states is that we could say, both that service delivery declined, that there was a lot of variability. We were able to learn that technology, home visits, and other measures facilitated that service delivery. And that, using the publicly available data, we could also say, triangulating with our data on phone surveys, that service restorations had happened after the stringent lockdowns were lifted, but had not restored to pre-pandemic. We know that there was tremendous work going on in terms of keeping pace at a policy level, and the number of GOs and other such things that were issued was tremendous, at this time last year, and that probably really helped very much to keep services going. From a measurement perspective, I should say it was feasible to harmonize measurement tools, but it's also because we started early and started working with the entire network. But there, because different people were using sort of whatever sampling possibilities they had, that still constrains the representativeness, which of course constrains interpretation. So to conclude, here are some key asks, I think, from measurement perspective, both for the core network itself, but also for the wider network of researchers, that on food security, I think we absolutely need to get to at least some common core of harmonized measurement tools to help interpretation. And there is still some way to go there. The core network, our working group itself, has to just come to some decisions and maybe make some recommendations. But given the fragility of the situation, and the fact that the pandemic continues to roll, that there are periodic lockdowns, that people are affected, we should be investing in continuous data collection, especially across vulnerable geographies. On nutrition and health services, harmonized tools for service delivery assessment, interviewing frontline workers are tested and now available to anyone who wants to use them. But we still don't know enough about coverage and use by the client populations, either from surveys or from the HMIS data, because admin data is not available in public domain.
Great. Thank you so much, Purnima. One request I do have of you is to please do share the findings if you do have them. If you could put that in the chat, that would be fantastic. I really do relate to this whole, need to harmonize. We, IDinsight, collected about 6 rounds of data of surveys, over the 7 to 8 months. Each of those was around 5,000 households. So, large exercises. And we were also scrambling in terms of, understanding what the right measures were, and also in terms of what would work on the phone, because that was the big constraint, is figuring out what would work on the phone, because what we were doing was remote data collection, given the pandemic. And so what I'm actually interested to hear about is the use of, these insights, given that many of us have put in efforts to collect a lot of information. So I'd like to turn to Dr. Dipa Sinha and to hear a little bit about, what you found with the Hunger Watch survey, and then how the findings informed your advocacy efforts over time, because, it was, again, a dynamic year. And, how did the data continue to inform your advocacy efforts? The government then also, responded with the One Nation, One Ration Card policy. What was your take on that? And useful to hear what the response has been. Thanks.
Yeah, thank you. Thank you, Divya, and thank you, everyone, for including me in this panel. So I'll begin with the Hunger Watch. So So the Hunger Watch survey that the Right to Food campaign coordinated, we managed to do it in 11 states finally. It was not a phone survey, it was an in-person survey. And right from the beginning, the design, I mean, the whole idea was that it would be action oriented, because this was a campaign conducting the survey, not a research organization. The purpose was to find out what's going on, but also to collect data which could then be used both for advocacy at the state and national level, but also at the local level to identify families, because there was already a lot of anecdotal information coming that there were certain communities and families very much in need, but not covered under any of the safety net programs of the government. So to also identify such households and to immediately help them access some entitlements. And given the situation, something that the campaign usually does not do and does not have expertise in, is also to try and get help from non-governmental sources as well, just because it was quite a desperate situation. We managed to reach out to about 4,000 households, and what we found was and the survey was done around October last year, and what we found has been validated by a number of other surveys that Purnima just listed out, is that food insecurity continued to be a problem even around October, which was 6 months after the lockdown happened, although situation was slightly better than what it was in the months of April and May, when it was the worst. But without spending too much time on the food insecurity part of it, which I think is quite accepted now and it has come out in all the surveys, I think one or two learnings that we had from the survey, which surprised us to a small extent also, was how effective the public distribution system was indeed in reaching out to a large number of households, because we also know that it is not the most efficient system, but we did find that people who had a ration card did get their rations. People who had a ration card under the National Food Security Act, over 90% got those additional 5 kgs of food grains and dal. There were delays, there were those kind of issues, but most households got it. And the data, the quantity, the numbers don't show it, but from the conversations, it was clear that that really helped keep people away from starvation. That was the minimal line, because despite getting that rations, you still had so many households saying that their food situation was worse than before April. But at the same time, if they did not have even this, then the situation would have been much worse. I think that is something that really hit us from the survey. But at the same time, what we also saw is that those who are not in the net did not get into it post the COVID situation. So people who were excluded from ration cards, people who lived very far away from Anganwadi centers, these households were the ones which remained excluded even after the lockdown and the pandemic. And they were, of course, also the most marginalized. So the demands around universalizing entitlements, at least during this period, in a temporary manner, considering that this is not a normal situation, is something that was strengthened. The other was the whole, even though it was just that 1 kilo dal in PDS, that was the only diversity actually happening, because, and in certain states, it was not just dal, there were certain other things, oil also being given in that basket. So what we had been saying before without data, but even more strongly that came out after Hunger Watch, was one, that even 6 months later, that 2/3 of the households reported that their food consumption, both in quantity and quality, was worse than before. And two, that the existing safety nets of the government does provide a safety net, that they do work, but that it is insufficient both in terms of coverage and also quantity and the quantum of assistance. How we used it, therefore, was the thing of how we use it was part of the plan right from the beginning. So we did write articles in the media, we did a press conference, it did get some amount of coverage. And this happened, we did the survey in October. One of the main things we tried to push, of course, which we didn't succeed in, was to get the Pradhan Mantri Garib Kalyan Yojana to be extended for a few more months, which ended in November. But it's just been announced after we started the session. I saw it that they have announced it for 2 months now, again in May and June. The other things that we also saw in that is that the PDS was the most effective. ICDS and midday meal, the coverage was lower. And therefore, that's what we started thinking about on what could be the nature of assistance through these programs. The cash transfers didn't seem to work very much. The amounts of cash was very low. But at the same time, in states where take-home rations were given in the form of dry rations, like for example, Rajasthan just gave rice and dal and oil, even for the ICDS beneficiaries. And that also seemed to work, once again, because people saw value in it. So there was a lot of pressure. They made efforts to go and get their take-home rations because it was very useful as additional food to the household. So there has been some amount of coverage, and I think it helped in at least as part of all these other surveys, not just Hunger Watch, to make this an issue, to get governments to accept that food security is one of the insecurities, one of the outcomes of the pandemic, and our response in the form of the national lockdown, and that something needs to be done about it. We did get that kind of media space to be able to talk about it, but when the budget came, it was quite disappointing to see that in terms of additional resources, it was still very meager, which was a little disappointing, because it's not just these surveys, there was also the NFHS 5 by then. One of the responses that the government has been putting out officially is what you said, the One Nation, One Ration. The issue with the One Nation, One Ration is that it does not solve the current problem. So One Nation, One Ration is to address the issue of people who have ration cards, basically migrants, because in the current PDS system, you can take your subsidized rations only from the shop to which you're assigned. Under One Nation, One Ration, you're supposed to be able to take it from everywhere and it is based on the Aadhaar platform. While there are a number of issues with Aadhaar, without going into that, given the time, it does not solve the current problem of food insecurity, because one, it does not address those people who do not have a ration card to begin with. So the NFSA coverage is based on population ratios of 2011. Population has increased. Even just by that metric, there have to be about 10 crore more households who are covered under the NFSA. And there are a large number of people who don't have ration cards at all. The second thing, again, for the One Nation, One Ration to work is only for the entire country to be the Aadhaar seeding to happen. Otherwise, it doesn't work. And a lot of campaign for people to know that this is possible. So even today, if you check in April, there are only about 10,000 households that have accessed using this One Nation, One Ration. That is really very, very tiny given the scale of the problem, and 80 crore people have PDS ration cards currently. So there are a large number of logistical issues also that need to be resolved for a scheme like One Nation, One Ration. In the current context, what I would like to say is that it is definitely not a sufficient, it is not a response to what we are going through currently. What we are going through currently is more than the usual malnutrition problem of India, which exists, or the food insecurity. But currently it is hunger because of the pandemic and the economic disruption that it has caused. That requires urgent solutions to ensure, and in a manner where there are no exclusions, which would be more in the nature of things like the e-coupons that the Delhi government did, where it said that those who don't have ration card could apply for a temporary e-coupon, and about 50 lakh people in Delhi got rations for 2 months under that. It's more those kind of interventions that would work. And just to end, we have more food stocks in the FCI godowns now than we had last April, which was already extremely high. And that alone is enough to say that we really need to be doing much.
Great. Thank you so much, Dipa. And that actually resonates a lot with our findings too, in terms of the, the way PDS really was able to swing into action very quickly, and the coverage was very high, but still there are people being excluded, and the quantity and quality, is still problematic in some ways. I'd move to Dr. Sujeet, and it would be great to hear from you on Poshan Abhiyan and how that has adapted to the COVID situation, and also how you have your advocacy groups have kind of swung into action, and what are you advocating for in the current context? That would be great to hear. Actually, not in the current context. Right now we're talking about the year behind us. Like what did you advocate for?
Yes. Yeah, thank you very much, Divya, and good afternoon, everyone. First of all, I'm Thank you very much. I'm delighted to be part of today's platform, Valid, and we know this fact very well that the spread of COVID-19 has impacted health, nutrition, livelihood, and well-being of India's most vulnerable population, and will have lasting effect on people. Like based on the assessment of the coalition, because the coalition is a group of members, those who are coming from civil society organizations, the program leaders, and they are representing different parts of the country. And all of us are aiming for good governance, good policies. So we try to assess from the different parts of the country and the impact of malnutrition during this COVID. Though the Poshan Abhiyan from the very beginning tried to reach out to the state government, like how the supplementary nutrition can be ensured at doorstep of the target population. But the impact of malnutrition increased, especially among children and mother, in an environment in which health and nutrition services were reduced, or I can say destroyed. The caring structure had broken down within the society and trauma was prevalent. So even we faced like lots of challenges our service providers faced to provide the supplementary nutrition THR at the doorstep because of the mobility, because of the spread of virus, the threat, and also the acceptance from the community. So there was an issue like of such things, and with the help of our community-based organization or even the self-help groups federation, we tried to like how the volunteers can come from CBOs, CSOs or CBOs, community-based organizations and the SHG, and how they can help the service providers. But based on, we also face lots of challenges about the data because we are not having the correct information about like the location GIS, like the pockets, so we faced all kinds of challenges there, and we together at coalition level. So this is one part, but based on the telephonic, we already Dr. Purnima has mentioned, like almost like in Jharkhand, we tried to get some information with the help of the telephonic interviews. So almost 60 or 70% responded, confirmed that yes, take-home rations are reaching. So almost there was a gap, and you can understand what I'm trying to say. The destroyed, how the reduced the system was destroyed and the caring structure was broken down. So together at coalition level, together we realized that a situation like COVID demands a long-term strategy to curb malnutrition, which is sustainable and cost-effective also. And for that, last year, the coalition with our members and well-wishers, as well as the Ministry of Rural Development, Ministry of WCD, FAOs, and we try to organize series of consultation, try to understand the best, what best we can do together. And during the series of consultation with all the members, we learned that nutrition garden is an indigenous and a sustainable, you can say, the solution for nutrition security, food security, as well as food safety, if integrated with the existing government system, or such as ICDS. And the nutrition garden can also provide the local employment, the diet diversity, which is responsible for huge burden of undernutrition in the country. So the subsequent momentum and interest encouraged us to come out with a kind of compendium of the best practices, which is ready to refer the menus on design, which we got from the different parts of the different pockets of the country, so that there is no need to reinvent the wheel and generate the new ideas and generate the new practices for the taking the Nutri Garden forward. And I'm happy to say, like, the Ministry of Women and Child Development has recognized the importance of Nutri Garden. They have also received support from the convergence through Ministry of Rural Development, Ministry of Ayush, and now Ministry of Women and Child Development has conceptualized Mission Kalptaru to address the problem of malnutrition through plantation of fruit trees and medicinal plants and herbs with focus on improving diet diversity and sustainable outcomes, nutritional sustainable outcomes. So this is, I'm very much hopeful that by this way, we can go for a sustainable nutrition, and when the country is going towards the Atmanirbhar Bharat, how that will contribute in a very positive manner. Apart from that, I would also like to share here, like based on the consultation series of consultation with the state and the state functionaries during the course of our all consultations, we realized that the need to strengthen the technical capacities at the state level with the state authorities, the department and the functionaries, and developing resilient food and nutrition system that is very much needed. So that's the learning coalition is having, and I'm very much sure we'll address with the help of government and as well as the civil society organizations. So this is and the role, we also realize that the role of civil society organization today and in coming days will be very, very important. Even with so much of negativity, there is a silver lining for nutrition sector, which will make the country more stronger and make its own place much relevant in the coming years. So that's the expectation I'm having from the civil society organization, that how from the national level to panchayat and the government, how we can together, if you can plan, how and we can reach out to that level. So this is the proposal we all are having, the coalition, and with the help of all our members and the from the different parts, reaching out to the national government, the state government, as well as to the down the line local governance, the panchayat. Yeah, thank you very much.
Thank you very much. So important to have a strong civil society, community, and I think specifically in India, at the beginning of the pandemic, it was really impressive to see the kind of momentum and focus on migrants and all of that. So thanks a lot. Moving now to Mr. Bishow, I wanted to first congratulate you in terms of, the World Food Programme winning the Global Nobel Prize for 2020 for their work on, their humanitarian efforts on addressing hunger. And kind of linked to that is kind of understanding what last year was like for you. In India, how your work with both the national and state governments, what that looked like, and what your main focus was, given that, you're looking at supply side issues in particular. So would be great to hear what you've learned over the last 1 year.
Good afternoon, and thank you very much for this opportunity. It's a great platform to exchange and share ideas, and as well as move to do better going forward. So I think it's I want to congratulate for hosting and planning this event. So the World Food Programme role in the context of India is not the same as in other countries, for obvious reason, because India has over the years progressed tremendously in improving increase in local food production, and with food security law and the safety net program, a lot of issues are nationally owned and addressed and constantly being improvised and capacity being built towards that. So in the context of that, the WFP role is completely different, but I want to first comment on some of the things what I heard from the previous speakers, and a lot of it, at least what Dr. Dipa said, resonates with my own experience and our organization's experience. I have to tell you, in fact, before even the lockdown happened, and with the COVID, we were already anticipating the challenge could happen on food and nutrition issues. So we're already giving various advisory messages to government. I wrote letters to Secretary Food, Secretary Niti Aayog, a number of government with various elements of advice. More a potential element to need for increased support, because the livelihood would be a threat and risk, and also prevention in terms of way forward to reduce. Irrespective of what we said, we were extremely impressed with a quick government response in terms of increase in food ration, 5 kilo plus 1 kilo pulses. That's one part of it. And I also got associated together with my colleague from FAO and IFAD with the Empower Group 5. And in fact, with my team in several states, together with my colleagues, we are giving ground-based information of both concern and the positive element to learn to that group on a daily basis. The group was meeting at 9 or 9:30, and we were reporting by 8 in the morning on Saturday, Sunday, holiday, every day for 3 months. And followed by that, we had a occasional consultation with the chair of that group to exchange on. There was a extremely positive response, and based on these, it's not a data work like you do in your research, but this is more like quantitative, qualitative, information and update. And we also checked further by looking at how much the uplift of food was taking place, and how much the people were benefiting from it, and etc. And I will give you some statistics on that, which will tell you some indication. There were 7.5 to 8 million tons were being picked up every month, and which was double the previous time. It was picked up by people, not just delivered at the stores. That supports the. And the second is, during the first week of the month itself, the uplift from the warehouse, from the distribution side was almost 85–90%. That also indicated the maybe the demand and the necessity for the consumer to go and access food because they want to have food in hand. Third part is a lot of time we found that in different states, I wouldn't say in all states because we're also limiting this into only 8–9 states. Some states were extremely proactive and extremely engaged and flexible. In fact, the moment they found people who are not holding ration cards and etc., they included them, they adopted them as a part of it, and they waived those. That's number one on the TPDS. As Purnima mentioned, under ICDS, although everyone was on lockdown, I think we had to be empathetic and understand the situation was exceptional. Everybody was worried, the COVID attack and the consequences. So everybody was, looking into, and those heroic Anganwadi workers delivering food in the red light areas, and also authorities on midday meal ration, etc. I think those are very commendable steps. And also to note, the food ration, although initially it was planned for 3 months, it got increased to 6 months and until 9 months. So obviously the effort to do this, the positive element is there was enough food stock available. to deliver. And then there were these extra efforts, commitment to make sure that nobody goes hungry. Sadly, there were reports about many migrant worker walking died of thirst or hunger or whatever it is. Those are painful. And also another thing to note is the uplift from the center to the states was allowed for 6 months in one time compared to in the past. I wrote an article about this. It's in the Wire. You can have a look at it. It gives a comprehensive perspective of our observation and my personal views there. The railways had a double uptake. So there was like a huge commitment to make sure that everyone gets the food, nobody gets hungry, and etc. And I must say, from my, I have been to maybe 30, 40, 50 countries where WFP runs the operation. Irrespective of shortcoming here and there, I'll tell you, we are blessed with India's safety net program in terms of this crisis period. How it achieved to reach to those number of people, including TPDS, ICDS, and midday meal. Around 1 billion people receive food support. Imagine that number, 1 billion people. I mean, India is a continent. It's not a small, tiny country like, in the neighborhood, etc. To achieve that is a massive task. And there were a lot of these restrictions made at the beginning, but when they realized about, crop supply, logistics, they made a lot of changes. They were concerned about absence of laborers. They were concerned about gunny bags not available. They're concerned of, trucks not available. And then the license to them to travel, these restrictions. So, a lot of intricacy around. And then in terms of number, just to give you a couple of other numbers, for example, there were 230 million households, 30 to 35 million households were collecting food rations in this period. We did some analysis from our internal work, and also to say that 95 to 97% of the food allocated were collected from the center within that time frame. And so there was the general observation that 30 to 35 kilos of rations were collected by each household. However, I must say there were challenges in terms of timely and equitable availability of pulses. They were not available at the beginning. It seems that pulses needed processing, and they were not ready with that massive scale of supplies and huge challenges on that front. But also going forward, there were references made about adequacy and etc. I agree. Maybe for some families it was not enough. They were consuming less. But on average, I traveled to some of these states and I asked people about what was the contribution of these food ration during the crisis. I mean, you can undoubtedly ask anyone, they value so much that availability of extra food, and it really saved enormous trouble for most of the household who were entitled. In fact, we learned lots of things also in the operation element, which we are linking to work on. For example, these three programs, midday meal, ICDS, and TPDS, they are running parallel. Although the supplies, logistic supplies goes from food ministry, there could be an element of convergence somehow to benefit and maximize. So we are looking into that and working on it. That's number one. Number two is, in fact, we also suggested to closely monitor the situation of food availability and implication on nutrition as things move forward. Because if the economy is picking up, the people have job, livelihood or not, what is the level of food availability? In fact, we did a study in Odisha alone, one state as an example to understand this. We did one during the time and then after the ending of this thing. So although there is still, some households still have concern in terms of food availability. I was very glad to hear this note from Dipa that the government has agreed to increase this. In fact, I was already advocating on this for the last few weeks, so I hadn't heard that news. So, but very good to hear that element. And we had been talking about this even in a meeting the last week when Niti Aayog convened a meeting. I made that voice that to be ready for that, given how it takes. So I think I guess also I think we have to be contextually look at this. When you can't get out of the house to do surveys and collect data and all, it's sometimes easy to sort of project as a normal situation. So we need to take that into account. That's number one. Number two is, of course, the methodology in terms of monitoring, things have changed. And in fact, WFP does a lot of monitoring through phone system. There's a lot of new approach have been adopted on this. Now, and also, there is this realization that maybe food alone is not enough, and there is a need for cash and those type of things. At time, in fact, I have voiced that. I put it in record. Addition to food, if people get some element of cash, it helps to diversify consumption. And obviously, one of the biggest challenge in terms of nutritional level or malnutrition level concern is there's a monotonous diet, and I think it's very important to diversify that and intake. But I guess the machinery of this safety net program is so big, and regulatory framework are so big. Changing this in one way or other quickly, it's like turning a big ship in the ocean. You need a lot of space, a lot of moment, a lot of process and procedure. And I believe from my, I was in the mid 70s, late 70s in India. I've seen the green revolution, how India has, taken forward. Of course, there are lots of positive side. There is also a little bit of a negative side of sustainability element, excessive water use and all that that need to be corrected. But I think a lot of progress have been made, and there is a commitment. Now, the last point I want to say is, the Secretary General is convening a food systems summit and in September, and there is this consultation. India is already into it as a way forward to that summit, and there is one high power group leading this, and in the context of India, there could be two elements to be looked at. One is great example what India can share to the world, game-changing ideas. For me, this whole safety net program, we take it for granted in India. Many countries don't have it, I can tell you this. And I've seen, WFP massively. I was before here in Zimbabwe, feeding 50% of the population. I'm not saying we need to compare one country to another, but just learning from that. So this is brilliant to have it. This, 800 million people on TPDS, 120 million on midday meal and close to 100 million on ICDS. They are there, but we need to work with evidence and etc. to improve on it. And I'm sure government is ready. They are very intellectual people, committed people. But then second point is what can be done better? I know that doesn't probably concern you, but even on that, there could be element of data done that gives evidence in terms of changes. The whole issue of sustainability in terms of water use, climate change element. And so I want to say that, in the context of our WFP work, we also got involved heavily with the civil society groups. We signed an agreement, we engaged with them. We also set some example in terms of, technological, this one nation, one card was made. WFP has been behind the scene in promoting this. In fact, if you look into the posters of this, there's a little logo of WFP in that. We have been associating for a long time, and we've been working on improving on supply chain, like reducing cost. To answer to your question in terms of going forward, these are some of the things we are working on. India loses 65 million tons of food. It's a huge task to undertake to prevent those losses. And also, constantly to improve on, I think this one nation, one card system, for me, is a game-changing idea. The important thing is universal implementation, addressing some of the bottleneck, and I heard the Prime Minister himself is committed to that. The fact that anyway, maybe I'm exceeding my time. So let me just
so
stop
I'm going
here
to now.
And back to you. Thank you.
Yeah, thank you so much. That was fantastic in terms of, kind of underlining the scale at which India can, focus on areas, and also, just kind of the way that we were able to pivot at some point during the pandemic. But I guess is, are we able to maintain that focus? Because even, there is evidence that initially we kind of improved coverage and then it fell. And similarly, going back to questions around quality, exclusion, leakages, another topic that you brought up is just how do you ensure that frontline workers supported, are able to deliver these services in the context of the pandemic. Moving to Dipa, I'd like to hear, Dipa, since there was quite a lot of reference to you. What do you think is the way forward, given that there is a lot of potential in the system, but also there are huge challenges also in terms of vacancies and lack of payment for a lot of these frontline workers at the height of the pandemic. So what lessons have we learned on that, and how can we improve going forward?
Again, I think something all of us have been saying, so nothing new, but looking at the current context also is to again strengthen all of these. So this 2 months extension is a good announcement. Hopefully we'll hear similar things on maternity entitlements, on ICDS, on midday meal, on old age pensions, which was front-loaded last year once, and then we've not seen any improvement in that either. Many things, we've gone through this once, so we know what to expect in some ways. So if we could do that now without waiting for us to get to a very bad situation as far as food is concerned. For instance, insurance for frontline workers, there was major confusion till last week on whether that continues or not under COVID, basic things like that. Additional incentives to Ashas and Anganwadi workers, which was given briefly, whether we continue that or not. It's very clear that this fight against COVID is not over, that it's going to take some time. And even after COVID maybe goes, the economic distress and therefore the results of that is going to take even longer. And it's also clear, like all of us have said, that India has very strong systems of social protection, and it is for us to use it well and use it even better, and one hopes to see that. I just wanted to add one more point linking to Purnima's presentation as well, is the whole data point which everybody has been making right from the beginning. And again, we've had a year now. Why is the HMIS data not up every month? What is happening to ICDS data? I mean, we need to move beyond also these food insecurity scales and what all of us are doing. But ICDS does growth monitoring, is supposed to be doing it. What is happening to that data? Why can't we figure out where wasting is going up? What additional kind of interventions are required? Because we must remember that, yes, we fight COVID, but we also have the whole malnutrition burden, and we can't keep that aside for a few years because we are grappling with COVID. We don't have the choice. So this whole issue of real-time data, when we can have that for PDS now, you have the IMPDS, which is every day telling us how many people are getting under one nation, one ration. We've still not managed to get coverage data from ICDS, from midday meal, growth monitoring data, the basics. These are things the frontline workers are spending so much time in filling their registers and filling their apps. Why can't this be made transparent? I think that would make a huge difference also in highlighting the problem, and given the diversity of the country, allowing us to focus on geographical areas that need immediate attention.
Fantastic, thank you. Just moving to Dr. Sujeet, and then after that I'll open it up for Q&A for any of the audience members. Dr. Sujeet, what are you thinking in terms of going forward? What are the, how are you going to use the lessons learned with, as you said, from the Panchayat onwards?
This is a very important question, and collectively we are having lots of learnings in last 1 year, and the crisis brought us together again with more focused deliverables and objectives. And Dr. Dipa and Dr. Purnima talked about data. Definitely, that's the most important thing, the data, how to build the data culture, and how to believe that this is my data, and the data should be in public domain so that we can collaborate well and go for a result-based plan. But apart from that, I would also like to add here, in the present, based on the learning and the present scenario, based on the past year learning, the information technology can be leveraged for ensuring many services related to maternal and child health, such as use of mobile phone for counseling by frontline workers, and also using remote health advisory system. Already we are having in India the 104 services. So how we can think that such kind of remote advisory system and the strengthening the mother and child tracking system, link it with the this information technology and the remote advisory system. Apart from that, the Poshan helpline number, I think that can play a very important role for ensuring healthcare, immunization services, and the regular counseling through nutrition specialists. And we also felt in last 1 year, based on our discussion from the grassroots level to the block level and the district level, the building the capacity, the human resource management, the development, I think it's the core for in the present scenario, how we are learning from the last 1 year, the challenges which we have faced, and how we can build the capacity of our functionaries in such a manner so that they will be in a position to provide not only the quality services, rather to engage the community in a more meaningful manner. Then apart from that, the geographic information system tracking to identify the hotspots at the block and the sector level, and also done at the for the required actions, that is very much needed. And since India is a country where we're having large number of severe acute malnourished children, we learned in last year, after reaching out to the mothers, parents, family, and the service providers, the community-based care for acute malnutrition is the best way to tackle malnutrition in the present scenario. And there are champions there in the society, there are champions in the field, how we can learn from them and how we can learn from the evidences. And there are few states, those who have already initiated this community-based management. for the entire state. That learning is very valuable to take it forward. So these are the things I think the human resource management, the infrastructure, and some of the policies decision like community-based management and the data, I think will add lots of value in this in the present scenario. And I feel like on behalf of coalition, like COVID-19 is a unique opportunity to reform our nutrition sector, reform our food and nutrition sector. So that I wanted to offer here. Yeah, thank you very much, Dr. Divya.
Thank you so much. So I'm going to just ask a few questions that are in the chat. And Purnima, actually, there's a question for you, and also maybe you can talk about your growth projections and modeling that you have done. But apart from that, there's also a question here on asking, are there purposive surveys that are being conducted for, the surveys that you're conducting are mostly purposive, but can there be some surveys that are conducted like where you include information, for example, regularly into like CMIE, so that, that kind of data is coming out regularly? So that's a question for you. And if you could also talk about the other topic, that would be great.
So let me answer the first question first. I think it's really important that there is periodic data, particularly on food security, consumption, and the fact that there is now a cluster of so many questions that have been tested to understand how households are experiencing food insecurity and what coping strategies they're using, so on and so forth. I think those questions can be integrated into any and all routine survey data collection platforms. That said, I think what's absolutely critical is that that data be in public domain, that it be shared with users, that the problems not be denied, et cetera, et cetera. So I think, we can't just look at the data issue as one of the collecting of data, but sort of really going through the entire value chain in the sense of, data being, delivering outcomes. On the modeling piece, last year, approximately around this time, the global nutrition community also came together, really, I think, concerned about, the unfolding of lockdowns and potential food insecurity, disruptions to programs, economic fallout, et cetera, and has done a lot of modeling. And in a global seminar recently, I was asked by someone, what can you say? I mean, those models, especially the models predict that the biggest impact on global child mortality and wasting estimates, et cetera, would come from countries like India, which carry already the world's largest burden of malnutrition, but also the largest number of children. So any global models are affected very substantially by what happens, here. And again, I sort of had to answer that question saying, I actually don't know, because to me, there's two things. One is we don't really have the data that we need on what has actually happened to, child wasting or even, I think child mortality, severe wasting, et cetera. And Aryan and I don't know if Aryan's on the team here, but we have been discussing the need for critical nutrition surveillance to deliver those kinds of insights. The second is, I think the global projections don't account for the vast social safety nets that, that exist in the country, because the modeling tools are not set up to account for nationally specific safety nets. So for me, again, I keep going back to the idea that, my wish list would be to have, at least in some districts, periodic data that, that is collected with really good quality methods. And Bishow, I want to assure you that to me, it doesn't matter if it's quick. You can be quick and clean. You don't have to be quick and dirty and get good data back. There's a lot of experts in the room, including Divya, especially Divya and her team, I should say. So we should really be trying to bring together the data that helps us say, okay, this is what's happening here at this point in time, be able to follow that through, and then be able to bring it back to, for example, the global modeling community and others to say, is there a way to account for the potential protective mechanisms that, good social protection, or at least social protection, even if it's basic, that reaches a lot of people, can then come back into modeling tools, etc. So I think there's really a lot of work to be done on this front, but without knowing what's happening on the ground, or without having data that's in admin systems be available to the public, I think it really ties hands in being able to tell, the story is never always horrible or always positive. There's always a mix. And it's when the data is in public domain that we can tell the full story. So that's all. Thanks.
Yeah, thanks. Actually, that's a good segue to Sunita's question. Sunita has noted that it almost seems like a surprise that social safety nets worked, and that's kind of unfortunate in a way that maybe because of the lack of data that's available, and if the data was more available, we could probably make a stronger case that social security nets have worked. And of course, there's room for improvement, but like having that data kind of gives you a sense of what's working and what's not working. Question from that was Sunita Krishnan from BMGF who made that comment, and her question was, I'm going to club a few questions. So her question was, do we need more data to make the case that social security nets work? Then another question from Hari Nilesh is, like it was pointed out, there are not too many tools to assess and measure consumption. How do we propose to go forward and bridge that gap now that we have more supply side data? And then I think the last question here is from Tanvi. According to you, which solutions and initiatives have emerged, in the context of COVID in India that can be used to ensure equitable and sustainable access to food in the coming years? So I feel like some of these questions have been answered a bit, but I think maybe this kind of gives us a chance to wrap up in a sense that if each of you would like to, take a minute to add anything before we finish, that would be great. So maybe I can start this time from Dr. Sujeet, and then move to Dr. Dipa Sinha and Purnima, and then we'll end with Mr. Bishow.
Yeah, thank you very much, Dr. Divya. And the call to action, I should say, like historically, nutrition has never been seen as high on the political agenda, and today the way nutrition is there. So the most important, the invest in food and nutrition security, that's the need of the hour, and to sustain leadership for food and nutrition within the existing system and leverage the COVID-19 scenario to emphasize a collective multi-sectoral approach. Otherwise, it's not possible if you're not taking the nutrition sensitive and nutrition specific together. It's a kind of multi-sectoral approach is very much needed to strengthen the holistic system to support better nutrition. And I strongly feel that if the nutrition system will increase, it will have the ripple effect to health, education, water and sanitation, and we can see a kind of holistic development. So that's the learning I'm having in last 1 year, and I wanted to say that this should be the call to action from my end.
Yeah, a bit of a repetition, but we'll see it again. I think the surprise was not that safety nets work, but that they work as well as that they do. For some of us, it was a vindication of what we've been doing for all our adult lives. But also the lesson that universalization has some merit. That's one way you can ensure that nobody is excluded. So trusting communities and people to not misuse systems, but making them available for everybody who needs them. Right now, our systems, even at a time of emergency like COVID, are totally, the orientation often is to ensure that one undeserving person doesn't get it. I think that needs to really change, and needs to be about how everyone who needs these services are able to get it. Multi-sectoral, all of this nutrition people have been saying for so long, and we need to do that. So things that we haven't spoken about, Narega, various kinds of livelihood schemes, because employment and food security is a huge issue. And along with that, the entire focus on women, women's empowerment, childcare services, maternity entitlements, these things seem to have taken a complete backseat in the last 1 year because things are so disrupted in everything else. But that all of this needs to come back, and the data point as well. What is happening to the rest of NFHS 5, and when is NFHS 6 going to come? Because NFHS 5 now anyway is post pre-COVID. I don't know what we'll be able to make out from it.
Purnima, do you want to go next? I mean, there is a good question here that that I wonder if you can also kind of answer, which is, we didn't touch on cash transfers, and what's your sense, like why the focus on Nutri Gardens only, given that there are a lot of other interventions that where there is evidence showing that they do work.
Yeah. No, I think it is time for us to summarize the evidence. Nutri Gardens do not reduce stunting, do not really reduce anemia. We should be very clear about that. Nutri Gardens are good for dietary diversity. That's it. The evidence is very clear on that. So, but cash transfers, on the other hand, when coupled with targeted foods, when coupled with good behavior change, can do quite a lot. And it's no surprise because cash enables people to buy things that they really want for themselves. And also, there is no, unless you count the tremendous effort sometimes that it takes to get cash out of cash transfer programs in many large countries, there are huge household burdens in terms of implementing Nutri Gardens and other such things. So I think we have to look at programs in balance. And so personally, I think it's time for us to summarize the evidence on some of the solutions that are being put out to say, what do we know about the impact of those and what is the relevance then for India? But I think in India we haven't made progress on the. We have we have a cash transfer program in design, which is the maternity cash transfer program. It targets the right age group. It has been rolled out in many places, in research that we've done with Manoj Mohan, and we know that there are several bottlenecks to the cash reaching in time. And I think there lies the crux, because what you want is the additional resource, which is the cash, to reach at the same time that women should also be getting their health services and the nutrition behavior change. If you get your nutrition behavior change messages in month 3 or 4 of your pregnancy, but your cash doesn't come until the pregnancy is over, you're not going to get the synergistic impacts of it. So I think, there's a lot to be learned on actually making the cash transfers that are in the system work better for nutrition. And some of us are very, very interested in exploring that because we think everything is there in the system. It's about making it get to households at the right time. So, let me, I think stepping back to this discussion and COVID and, our data strategy and all of that, I think my sort of number one takeaway is that India is not without the policy instruments that are needed to mitigate the impacts of the pandemic on people. What is crucial for us to do as researchers is to be able to collect the data, that tells us how well that is reaching people, who is being left out, but also what is actually happening for what's expected. It isn't just about the reach of the program. If you're getting your 5 kilos of rice or your 1,000 rupees of cash transfer, and you are still hungry, and you still have food security, and you still have poor diets, that should lead to reformulations of the program or to really thinking about what additional assistance is needed. So this is why I think, the data strategy of having data on food security and the reach of the safety nets together is what's going to get us, towards sort of more reach, sort of stronger programs and impact for people who need it the most. So let me stop there. Thank you.
We're almost out of time. Actually, we're out of time. But Mr. Bishow, if you could wrap up with your final thoughts.
Thank you very much. I completely endorse Purnima's points. I want to start with that. But let me say, in terms of call of action, I think few issues. There is a lot of inclusion and exclusion errors in this whole system. There is already work on that, but that needs to be operationalized. That's in one area. The second issue is convergence, the point I raised before. And the third point is there are lots of evidence. I work with IFPRI in Yemen, most difficult situation, making a study of caste versus food. And I tell you, there was equal or more impact with caste than with food. So it's not that. But I think in the context of India, the food transfer has a different notion. It's the link to agriculture, MSP purchase and all these elements. So overall economy element is important. So what would help is among these Anganwadi workers and others, complementarity of caste to buy and diversify food can be very useful. And going forward, I also want to say that technology, use of technology in the overall context. One thing, very glad to see, the biometric system, one nation, one card. These are reducing leakages and misuse of resources, and it's very important in the overall context of transparency and etc. But I would also not downplay the importance of the overall diversification. The point that was made before about NutriGarden and other things, and most importantly on women and gender issues. Women eat the last. They may not be left with the meal when everybody eats. And there are cultural consideration, the pregnant women, the lactating mothers and adolescents, girls, they have a different requirement. So it's important to look into their need in the overall context of these program and move towards constantly improving overall. This big safety net program India has done is blessed with. Thank you.
Thank you so much. So I guess just quickly wrapping up is that, my takeaway from this is, India, like we have the potential, we have these systems in place that, really can pivot in the time of crisis. And, we do need to kind of include NGOs, CSOs, and get them to be involved. We need to kind of improve the data transparency, the measurement. But in terms of data, what was kind of really interesting and useful to be reminded is it's not, just monitoring, but also data that in terms of what's, how things are going in terms of implementation, in terms of feedback on what's working, what's not working. I think that's also very important. So transparency of the surveys that we're collecting data on, but also of the administrative data that's being collected. So, and everybody across the board is talking about how they have used data in their operations and how critical it is. And then, of course, the fact that nutrition is so multi-sectoral, it's so important to, include women and children as the core focus. One thing we didn't touch upon is the fact that schools have been closed throughout this. So, like midday meal has not been, happening. And so basically, there's just so much still in terms of where we want to go. And hopefully, last year we said the same thing, that maybe this is an opportunity for us to kind of really, come together and build something stronger. I think we didn't really do that. So maybe now is actually the time to really put our heads together and really move beyond where we started pre-COVID. So thank you so much. And thanks for all of your time. It's been really interesting. Thanks for engaging very energetically. Greatly appreciate it. Basically, I'd like to thank IFPRI, of course, and the CORNET community. But thank you so much.
At 6 o'clock, we have another plenary. In case if you have some more time at hand, we're going to be discussing the impacts of COVID-19 on family planning and sexual and reproductive health. We'll have ICRW present evidence from the past year, and then also have Dr. Sushanto from IPAS talk about what the implications were for abortion services. We'll have Todd Callahan from DKT India, who'll talk about service supply side challenges, and we'll also have this person from UPTSU. I'm really sorry. I'm missing out their name right now. Dr. Preeti Anand from UPTSU. Yes, I'm sorry. Who'd be sharing her insights on implementation, and Dr. Gogoi from C3 who'd moderate the conversation. So in case if you have the time, do join us for that. Thank you.